Hello and welcome, Satnam. My name is Grace, but most know me as the Bronx Doula. And as promised, here is another one of my videos. Today we'll be discussing swelling. Now we know that most of us during our pregnancy will experience some level of swelling. Every nook and cranny of your body will be feeling it. Right? Right. There's poor circulation happening. Again, you're growing a human being. Maybe you've been standing too long or maybe lying too long, using things that are tight around your body, which further restricts the flow of fluid in your body. The volume of blood has doubled because you have a human being in there that needs some of that circulation. And also your body needs to take care of itself and stay healthy so that you can birth and deliver a beautiful baby. Now, things to think about when it comes to swelling is, did this swelling begin from the beginning of the pregnancy or your gestation, right? So from the beginning, or is this something that happened suddenly, right? You had a busy day the day before. Maybe you were on your feet, you had some fun, came home, went to bed, and when you woke up, boom, suddenly your hands are super swollen, or maybe it's one foot that's really, really swollen, or both. Maybe you're feeling swelling around your neck or your eyes. Where is the swelling and how did it happen, right? Is it sudden or is it something that's been happening throughout the pregnancy? It's important for you to keep track of the symptoms that you're feeling aside from the swelling. So you have swelling and you're experiencing headaches. You have swelling and you're experiencing blurred vision or spots, floaters, you sparks, like little flashes of light in your sight vision, your peripheral vision especially. Are you experiencing nausea with the swelling? Or maybe you're experiencing all of these symptoms along with the swelling. This is important information to know and to tell your midwife, preferably, uh, or your OB, and maybe you're seeing a family physician or a nurse practitioner. It is essential that you let them know what is happening with your body and when and how it's happening, right? Because this can signal some really troublesome things for some of us, especially for women of color and women of culture, right? We know that women of color have a higher incidence of high blood pressure in pregnancy, of having eclampsia, and having other comorbidities that happen during pregnancy. And it's essential for you to be an active participant in your care. So you need to know what's happening. You need to discuss it with your midwife or your other care providers and learn what can be done, right? Unfortunately, high blood pressure, eclampsia, and other things can cause the parent to um, have some complications after or during the pregnancy and the birth. It could also affect your growing baby. So it's really important that you discuss this with someone, a medical provider, your midwife, so that you both can sit and decide what are the next steps. Okay. Now, eclampsia can happen during pregnancy. It can also happen during the labor, the actual birth, and it can also happen right after, during those first few hours after the baby's born, during that postpartum recovery period. It can come as something as a slight headache, right? It's bothering you, but it's not really bad. But it's not normal for you to feel this way. You haven't felt that way throughout your whole pregnancy, right? Maybe you have swelling in your legs. What's happening there? All these things are important. You must let your practitioner know. Think about it. Does the swelling happen abruptly? These are some of the questions that you need to ask yourself and then relay to your provider. Is the swelling choosing a side? Is it on your left side? Is it on your right side? Is it on, I don't know, what part of your body? And it's not happening on both. Right? Is your swelling only on your face? Is it only on your feet? Only on your hands? Is the swelling accompanied by other symptoms which we will discuss? Are you having headaches, nausea, dizziness? Are you feeling heart palpitations? Like you're going to have a panic attack, but not really. And again, these symptoms can happen in pregnancy, it can happen during birth, and it can also happen right in the first few hours postpartum. And it's essential to know what's happening with your body. I usually recommend for my clients to have their own pressure cuff at home, especially if you are a person of color. Have your own blood pressure cuff at home. Okay, take your own blood pressure and know what normal is for you. We all have our own numbers, right? So, what does normal look for you? And keep a diary or a journal, right? Take your blood pressure early in the morning, take it again later in the evening, right before you go to bed, and see how your numbers are changing. Are they staying steady? Are you having sudden spikes? Um, or sometimes your blood pressure might be too low, right? For instance, me, my blood pressure, even though I'm a larger woman, tends to be on the lower end, and you'll figure, whoa, she's a few pounds overweight. She should have high blood pressure, but no, I have low blood pressure, and that is just as important as having high blood pressure. Also, let your voice be heard. You've heard it in the media lately. You've had Serena Williams and other stars, prominent people come out and say, listen, pregnancy is an amazing experience, but it's not always pretty. And sometimes there are some things that happen later that can put your life or your baby's life in jeopardy. So it's important to know what is normal for you. Okay? Always discuss these things with your midwife, your OB, if you have another allopathic doctor, whoever's taking care of you and seeing you during your gestation. It is important to keep that line of communication open. And if you are in a hospital, make your voice heard. Let your partner know. Hopefully you have a doula as part of your support team. Let the nurses know, let the doctors know. If no one is listening, make sure that they hear you. Contact every hospital, every clinic has a business office. They have a patient um, information center where you can ask questions, where you can get responses to your questions. This is all part of informed consent, of giving consent, but also is important for your well-being and care. Okay? Remember, always let your voice be heard. Your health and well-being is very important. And yes, we know a lot of times during pregnancy and birth, most of us focus on the baby and forget that the parent who's birthing this child is also part of this transformative experience. That is all for now. If you have questions, you have comments, please feel free to email at info@bronxdoulaservices.com. Check me out on Instagram. Again, The Bronx Doula. Just type it in. Boom, you'll see me. And you'll see all the wonderful postings I do, mostly of placenta encapsulation. I tend to keep my doula clients and their births private because you are welcoming me into this wonderful, amazing space. And I value and honor your journey. Thank you so much for being with me today. May you have a blessed day. Sat Nam.